So we have Diane Kenwright from the University of Otago and Amanda Charlton from the University of Auckland. A bit of a dynamic duo in the education world, always coming up with cool new ways of going about. I have a really, sorry, someone snuck in and promoted Diane before I could do it. And Amanda has also been promoted, so thank you, Sam, or whoever behind the scenes did that. And without chewing up too much of their time, I'll hand over to Diane and Amanda, who, take it away. Cheers.
Kia ora, I'm Diane Kenwright. I'm a pathologist who works at the University of Otago, Wellington. Amanda, are you there?
Can you hear me? Here we go.
Yes, you're there now.
Right, yes, and I'm Amanda Charlton. I'm at the University of Auckland and at the Auckland Hospital, and I'm a pathologist there. So, and this is us, the dynamic duo, as Liam has explained. So, let me start off. So we've noticed students at all levels frequently have a negative reaction to learning to make a diagnosis from a histology slide.
But we think that we've solved that problem. We think that histology diagnostic skills can really effectively be taught on LT. We ask the question, how do we help students become proficient in histology, and importantly, how to make it fun and engaging?
Well, we're going to present a case study of a group of 15 eye surgeon trainees that we taught last month. We used a blended model. We created 13 eye histology lessons in LT, and they were designed to help the students become proficient in making a diagnosis from a histology slide. In the 19th century, surgical trainees were taught using the see one, do one method, where the teacher demonstrates, then the student practices. The problems with this method is it's passive and there's not active student learning. And in today's complex world, probably a single training event is not safe for patients. In the 1990s, Peyton, a surgeon, introduced the 4-step method for teaching procedural skills. Number 1, the teacher demonstrates. Step 2, the teacher demonstrates again, slowly, breaking the tasks into subtasks while explaining. This is a form of chunking. The student then explains the steps aloud, which is a form of elaboration. Then the student does the procedure by themselves. Why should this work? It's built on effective learning strategies of elaboration, retrieval, repetition, and dual coding. And here, dual coding refers to the multi-channel inputs of procedural skills. So that's voice, speech, visual, and kinesthetic. We adapted this method in 2 ways, from hands-on practice to the skill of making a diagnosis on a histology slide, a cognitive process, and from face-to-face teaching to online lessons built in LT, which Diane will show us.
So briefly, before I show you the lesson, these are the steps that we used. We used demonstration to watch the video. We used deconstruction, hotspots. We used comprehension, which is they had to answer questions in a rubric. And then we had another page where they had to show the execution on a similar but different slide. So here we go. This is an example of our lesson. They're here in the course playground, LT Brain Trust. So all of you can go and have a look at these lessons to see what we've done. Firstly, I explain the slide as an expert. And I continue to run through the slide, pointing out important features. Then in the deconstruction step, we use the hotspot feature so that the students can find the important features themselves and zoom in on them. to see what is going on similar to what they've seen in the video. Then we ask them to go to the virtual slide on their own, and we link out to the virtual slide site. They have to use their skills to explore the virtual slide. It's been a bit slow loading here. We won't worry about waiting for it to load. And at the same time, they have to show comprehension by filling in this list, this rubric here, to show that they've understood what they've seen is normal, abnormal, give a differential diagnosis, etc. They get feedback by just checking the answer. Then we ask them to execute on the next page by doing a very similar slide online. So they'd click and go to the virtual slide and then answering the same questions. They get feedback both by checking the answer and going to a hotspot picture showing the features that we really wanted them to see. Back to you, Amanda.
Thanks, Diane.
Should I share my screen?
Why don't you share your screen? My Google Slides has gone all blank.
Okay. Here we are.
Fantastic.
There we
we're
go.
up to student-controlled practice at almost at the end.
Here we go. We've done this bit, haven't we?
Well, this is a repetition.
This is
fantastic.
repetition. This is repetition. Okay, so we've just shown you the video here. We wrote lots of lessons. There's 9 shown in the little square here. Have a look at them. Okay, off you go.
So this was the delivery. It was over 4 weeks. There were 13 asynchronous lessons that the students could access at any time. And we've incorporated these motivational theories here of autonomy, competence, and relationships from self-determination theory.
So do you get feedback from your students asking for more LT lessons, lots more? Well, our students said, yes, we want more and more content. They loved learning like this. Amanda.
These were free text, anonymous comments that they spontaneously gave back to us when we just asked them, just comment on the LT lesson. So we will make more.
Okay, thank you. Open for discussion.
Oh.
There is one Q&A. How do we get to the course playground? So Liam's answering that one.
Just about to. So yeah, if anyone's interested in getting to the content that Diane and Amanda have showed, you can email me, and you probably have seen my email splattered all over the show, but I'll put it again in the chat, and yeah, if you email me, I'll be able to add you to that as well. So hopefully that's straightforward enough.
Okay.
And yeah, so no other questions, last minute questions for Diane and Amanda before we move on? No? All right. Well, yeah, thanks again, Diane and Amanda.
Thank you.
It's cool seeing what you guys are up to.